Who doesn't love a baby? Babies are beautiful, but babies and young children are vulnerable, totally dependent on adults and society to take care of them. Who would deny a young child nourishing food, clothing, decent shelter, or good medical care? And who would take a sick child to a hospital with crumbling infrastructure, peeling paint, and dirty floors, a shortage of beds, inadequate equipment, little medication? Unfortunately, lack of basic health care and inadequate hospital facilities in the 21st century results in terrible pain and suffering and death daily for millions around the world. These pictures were taken by Dr. Antena Roba of Houston, Texas in October 2003 on a visit to the pediatric units of 3 public hospitals in Addis Ababa, the capital of Ethiopia. As you can see, the facilities and care are woefully inadequate. 6 to 8 babies crowd into a small room. Some lie on cartons for beds. Children with highly contagious diseases lie next to patients with non-contagious conditions. Some patients gasp for breath, while others share the limited oxygen tanks available. "40 to 50% of the babies in these departments are infected with the opportunistic infections secondary to HIV/AIDS. For them, there are no retroviral medications available. Many of these children may already be dead as you are watching this video. Others will die before their first birthday. Pain medications are very limited and very expensive. Their pain is hard to watch. The helplessness so frustrating." Many other children were close to death with diseases and conditions such as tuberculosis, vitamin D or protein deficiencies, meningitis, malaria, diseases that are treatable and curable with basic drugs and equipment.
Okay.
It was on gentamicin, but then the blood diarrhea is now, the blood in the stool is not uncleared, but he has diarrhea still. So for the
Case of pneumonia.
The child is seropositive, and she's on clotrimazole and treated for tuberculosis, and now she's on prednisolone for HIV. This is also another child from orphanage. This is also seropositive. Yeah. Retraction
Which type?
While visiting the Zeweditu Memorial Hospital, Dr. Roba met Dr. Mogus, the head of pediatrics. Dr. Mogus explained that there was very little medication available, and no equipment such as respirators or incubators to treat babies who are born with or develop medical problems shortly after birth. Often, the medical staff can only provide human comfort while watching a child die, as far too many of them do. The only alternative is a transfer to the neonatal unit of Black Lion Hospital, the only major referral neonatal facility in the country, and itself in poor condition. Since there are no ambulances, transfers must be effected by taxi, or in the case of very poor parents, on foot. Depending on Black Lion's proximity to other hospitals throughout the country, transfer can be prohibitive. Dr. Mogus and the hospital administration dream of opening a state-of-the-art neonatal facility at Zeweditu Memorial Hospital, but cannot do it alone. Millions of dollars are needed to refurbish infrastructure and buy equipment and medication. Dr. Roba realized then that the purpose of his going to Ethiopia was to see to it that beautiful babies would have the medical care needed to alleviate pain and suffering, and provide the opportunity for them to have healthy, productive lives. This is no more than any of us want for our own children, and no less than all children deserve.